About 13% of the people in the United States are older than 65 years of age. The older population is expected to grow as more baby boomers approach late adulthood during this decade. Women live longer than men, although the exact reason for this difference is not known. This is part one of a two-part lesson. After this lesson, you will know how to teach selected evidence-based lifestyle practices to promote health activities in older adults, assess for polypharmacy in older adults and educate the patient about safe medication administration, describe the effects of drugs on the older adult, assess the older adult's risk for signs of neglect and abuse, and describe best practices to promote patient safety for the older adult. The aging population, also referred to as the elderly, can be divided into four subgroups. These are 65 to 74 years of age, the young old; 75 to 84 years of age, the middle old; 85 to 99 years of age, the old old; and 100 years of age or older, the elite old. Only 5% reside in long-term care facilities, and 90% of the 5% are older than 65 years of age. And 50% will have a brief nursing home stay. Thus, nurses and other healthcare professionals need to know about the special needs of older adults to care for them in a variety of settings. The vast majority of older adults live in the community at home, either with a family member or independently. The number of homeless people older than 60 years is also growing. Health is a major concern for many older adults. As the older adult ages, their body systems slow down, and many are afflicted with chronic and acute disorders. Health status can affect the ability to perform ADLs and to participate in social roles. As a person ages, the health issues they may be afflicted with can include loss of autonomy, losses by death, health promotion, discrimination, economic instability, adjusting to chronic illness, nutrition, mobility, stress and loss, accidents, drug use and misuse, mental health and or behavioral health, and or elder neglect and abuse. The minimum nutritional requirements of the human body remain consistent from youth through old age, with a few exceptions. There is a risk for protein-calorie malnutrition, psychology of eating alone, inflation, reduced income, and lack of transportation. There is a needed increase for intake of calcium, vitamin D, vitamin C, and vitamin A due to the changes in the ability to store, use, and absorb. They may have a sedentary lifestyle and a reduced metabolic rate, which causes changes for caloric needs. They will have a diminished sense of taste and smell, and possibly tooth loss and poorly fitting dentures. You will teach older adults that fluid restrictions make them susceptible to dehydration and electrolyte imbalances that can cause serious illnesses or death. Their most common concern in clients who decrease their fluids is in the evening hours to avoid getting up at night. Exercise and activity are important for older adults as means of promoting and maintaining health. Physical activity can help keep the body in shape and maintain an optimal level of functioning. The advantages of maintaining appropriate levels of physical activity through exercise include a decreased risk for falls, an increased mobility, increased sleep, reduced or maintained weight, improved well-being and self-esteem, fewer depression symptoms, improved longevity, and reduced risk for diabetes mellitus and coronary artery disease. Stress can speed up the aging process over time or can lead to diseases that increase the rate of degeneration. It can also impair the reserve capacity of older adults and lessen their ability to respond and adapt to changes in their environment. These stressors for older adults can be rapid environmental changes, changes in lifestyle, acute or chronic illnesses, a loss of significant others or children, financial hardships, or relocation stress syndrome. How people react to these stresses depends on their personal coping skills and support networks. Accidents are very common among older adults. The most common accident is falls, resulting in the older patient exhibiting fallophobia, a fear of falling, which causes one to avoid leaving home. Factors that increase accident likelihood is presbyopia, reduced sense of touch, decreased reaction time, peripheral neuropathy, and/or arthritis. Driving safety is another concern. Motor vehicle accidents are also one of the most common causes of injury-related death in the young to the old population, generally 65 to 74 years of age. It may be related to the decreased ability to multitask and the reduction in reaction time. You can encourage them to attend adult driver safety, such as attend driving refresher courses, avoid high-risk driving conditions, and be aware of their prescription side effects. Okay, we're going to talk a little bit about drug safety. Drug therapy for the older population is another major health issue because of the multiple chronic and acute health problems that occur in this age group. Drugs for older adults account for about 1/3 of all the prescription drug costs. The older population is prescribed multiple medications, also known as polymedicine, to treat multiple health problems. This brings us to the term of polypharmacy. This is the use of multiple drugs, duplicative drug therapy, high dosage medications, and drugs prescribed for too long in a period of time. In other words, polypharmacy occurs when there is inappropriate or unnecessary prescribing that results in negative outcomes. In addition, the older generation tend to use multiple non-prescription drugs such as analgesics, antacids, cold and cough medications, laxatives, and herbal or nutritional supplements, often without consulting a healthcare provider. These over-the-counter medications have the potential to interact with prescribed medications, causing adverse events. In addition, polypharmacy can be a result from the aging population having multiple healthcare providers for each different health issues. The patient may not be able to tolerate standard dosage of drugs. Physiologic changes from aging can affect absorption, distribution, metabolism, and excretion of drugs from the body. The rule of thumb is to start low and go slow. And you want to remind them to associate their pill taking with their daily events. For an example is during certain meal times. Encourage the use of pill containers for daily or weekly use. Have them ask the pharmacist for large print on the drug label or colored labels or dots that can be applied. They may also need easy open bottle caps, which can be very helpful. You want to avoid communication errors such as educational limitations, language barriers, or hearing or vision limitations. We're going to discuss geriatric pharmacology in subsequent lesson. Older adults are usually mentally sound and competent. A few changes in cognition have been identified as age-related and are linked to specific cognitive functions rather than intellectual capacity. These changes include a decreased reaction time to stimuli and an impaired memory for recent events. Decisional capacity is an individual's ability to identify problems, recognize options, make decisions, and provide the rationale supporting the decisions. This will make the individual clinically competent, which is when one is legally competent and can make clinical decisions. As older adults age, they are at increasing risk for cognitive health problems. One problem is depression. This is the most common mental health or behavioral health problem among older adults in the community and very much underdiagnosed. They can have mood disorders such as cognitive, affective, and physical manifestations that result from it. It could be primary or secondary or situational depression. We use a geriatric depression scale for an assessment. Treatment is usually similar to any age group. You can use drug therapy and psychotherapy and occasionally an ECT if they are drug resistant. Then there is the potential for dementia. This syndrome that involves a slowly progressive cognitive decline, sometimes referred to as chronic confusion. The global impairment of intellectual function is generally chronic and progressive. One example could be Alzheimer's disease and multi-infarctal dementia. Another concern is delirium, acute state of confusion. It's usually short-term and reversible within 3 weeks or less, often seen among older adults in a setting with which they are unfamiliar. It can include physical manifestations of change, hyperactive or hypoactive. And we want to know immediately, why is it so important that we recognize this? It's important to recognize this immediately because it can be reversed for 1 or 2. It'd be deadly if it's not reversed. Delirium is usually caused due to an acute illness or a toxic medication or medication interaction. Okay, so let's recap here a little bit. Dementia and delirium are different. Dementia is a slow onset and it's chronic and cannot be reversed. Delirium is acute onset and can be reversed. Another problem for some older adults is neglect and abuse, both verbal and physical. Neglect occurs when a caregiver fails to provide for an older adult's basic needs such as food. Physical abuse is the use of physical force that results in bodily injury. Financial abuse is property or resources are mismanaged or misused. Emotional abuse is intentional use of threats, humiliation, intimidation, and or isolation towards older adults. In the past, healthcare providers and family members restrained the older patient to prevent falls, to prevent them from injuring themselves, to prevent them from wandering, and just many other reasons. The restraints were either physical or chemical. In 1990, the federal government enforced a law that gives nursing home residents the right to be restraint-free. A restraint is a device or drug that prevents the patient from moving freely and must be prescribed by a healthcare provider. You want to try alternatives first and document it. If, however, a restraint is needed, you want to check the patient every 30 to 60 minutes and provide care every 2 hours. Use the least restrictive device possible. They have caused deaths. It's hard to believe, but bed rails can be considered a restraint. Even certain types of wheelchairs can be considered a restraint if they prevent the resident from moving freely or mobilizing as they would normally do. So for an example, if a patient that could not reposition themselves unless they had assistance was placed in a tilt-back wheelchair, that would not be considered a restraint. But if a patient could reposition themselves without assistance and stand without assistance or move their feet to move their wheelchair along, if they're placed in a tilt-back wheelchair and can't reach the floor to mobilize, that would be considered a restraint. Okay, I'm going to briefly discuss ethical issues. There are many ethical issues linked with identifying the aging patient. One identified is competence. It's better to seek assistance with other healthcare professionals if you believe an aging patient is not receiving proper care due to competence. You want to advocate for the patient. The other two also listed with much controversy are assisted suicide and euthanasia. As a healthcare worker, you will be faced with these ethical issues, often regardless of the healthcare setting you choose to work in. We're going to discuss this in a subsequent lesson. This concludes part 1 of a 2-part lesson. If you have any questions related to this lesson content, contact the instructor.